Welcome to the Chu on This podcast. Join your host, Dr. Katie Chu, and her guests as they chew on what matters, one story at a time.
Hi, so welcome to another episode of Chu on This, where we're going to be chewing on what really matters, one story at a time. And I'm your host, Katie Chu. So today I have one of my colleagues, Dr. Elson Lai.
Thank you.
Do you like to share a little bit about yourself to our audience for those who may not know you?
I'm a cataract surgeon here in the San Gabriel Valley. I started my own practice about 12 years ago. I have an associate now, and thanks to your referrals too, I'm a really busy cataract surgeon now, so thank you for having me on.
Yeah, definitely. For me, practicing for 30 years in this practice, I have to say that we do have quite a bit of ophthalmology that supports our practice, but it's a rarity when we find an ophthalmologist who actually, is real and genuine. And I do have to tell you that it's been a great journey in terms of referring my patients to you because of your ability to not just connect with my patients, but also to connect with me. Because I hate to say this, but sometimes you have specialists where I always say it's just like they kind of have a chip on their shoulder, and sometimes you can't get past that, and it's hard, as a referring doctor, right?
So thank you for saying that. I try to take care of everybody's patients that refer to me, and I treat everybody kind of like my family. So I try to get them as soon as I can.
Yeah. I am going to make a comment about one of the things that really made you look so different in my eyes. And I think you attended one of my dinner presentations for Bosch & Lomb. And at that dinner, you had mentioned about how we serve a underserved community of Medi-Cal patients. And you also had mentioned that, nowadays, based on the insurance reimbursement, that a lot of the outpatient clinics or hospitals may not be accepting Medi-Cal patients for surgeries, right? Mm-hmm. So what have you done to go around it? That's what captivated me last time.
Well, there's certain surgery centers that don't take Medicaid. Some of the hospitals that used to take them don't take them anymore. But, you find a few that will take them. And then so you just have to go search for them and be your patient's advocate, because a lot of the practices around here probably just give up and say, hey, we're not credentialed with the surgery center that you can go to, so you got to go find somebody else to do your surgery. Mm-hmm. And so I try to minimize their search, and I'll just go credential with that surgery center, and then we'll just take care of them.
Yeah, that's beautiful. And he mentioned something that is really, really, it resonates with me, is the fact that he's saying advocate. I think that is so important for our patients nowadays, is to be truly their advocate. And so I am going to let you know what we're going to do today is that we're going to be pulling questions out of hard chews and soft chews. We have two bags here. And what the hard chews are going to be questions that are going to be a little bit tougher, might cause us to pause a little bit and maybe even gnaw on the question a little bit. But I think that's part of the process, right? Yeah. And then you're holding the bag of the soft chews, and those are the ones that are going to be very, very easy questions and more palatable to our taste, right?
Excited to see what questions they
Yes. So since you are the guest, you get to pull from the soft chew.
All right. Oops. Let's see. Oh, it is.
And by the way, I have no idea what these questions are. My staff is the one that prints them out and puts them into the bag.
Okay. If you can really relive one ordinary day from your past just to enjoy it again, which would it be? Ooh, this is a tough one. I don't think this is a soft one. This is a pretty... One ordinary day from the past just to enjoy it again. I guess it's not really an ordinary day, but, we're going to go back to kind of like serving patients. I do enjoy going on medical missions. And those days for me are ordinary because I operate, but for them, it's not really ordinary because they can't see. but we see them the next day. We go down there. We're there for 3 days.
Where do you go?
We've been to Penasco, Mexico, and then Caborca, Mexico. And usually the Lions Club International will set this up for us. And then we have a full team that goes down there. We bring everything from lenses to the machines. And then we operate out of this room that we kind of set up as an OR. And then, we have about 30 volunteers, 2 surgeons, and we do about 40 cases. And we do all the pre-ops and everything at that day. But the ordinary day is the next day where, they take off the patches. And and then a lot of them start crying, and then you start crying, and then that's something I'll never forget. I still see that picture that somebody took for me, and that I still remember that little old lady that I did a hand motion cataract on, and she was crying, and you could tell how thankful she was.
Beautiful, so beautiful. I don't know. As you were answering, of course, my brain is like trying to think what's going to be my answer, and the only thing that really came to me was I just thought of my grandmother, and that feeling of she loved Johnson's baby powder, and just having her come out of a fresh shower and then having her sit next to me as I'm watching TV as a kid and just smelling that on her. I can even picture it right now, and I would love to just be able to relive that with my grandmother. It's just one of those moments where it's very, very special. Yeah. Okay, are you ready for a hard one? Let's see. All right, got 2 stuck here. 3. Okay, well, let's pick this one. If you could thank one person who helped shape your character, even if they'll never hear it, who would it be?
It's kind of easy in a way that the question's kind of easy because I know who it is.
Oh, okay.
Okay, and I think it's kind of cliche to say, my mother, but I'll tell you what.
Okay.
I think growing up in an 8-year household, we don't get the I love yous.
Yes.
We don't get the great jobs. We get the, hey, I got an A+. Try harder, right?
Yeah, an A+ isn't good enough.
Exactly.
You need that extra double plus.
Exactly. And not to say my dad wasn't, but I remember vividly one of my things I told my dad. I was like, hey, Dad, I got the second highest score on that calculus test when I went to Cal. And he was like, oh, great, try harder next time. And that was the response. And that's kind of the response my mother gave me once, too, was, I had a very difficult time transitioning from Southern California to Northern California when I went to college. And, coming from a high school where I did well, and then I go to Berkeley, a lot of people there are smart. And so you felt like I didn't fit in. So, and with the change in environment and me not knowing how to study up there, I complained to my mom. And so what did she say? She's like, fine, come back and go to community college.
And did you do that?
I did not pick it, but I think it was a psychological statement for me to say, oh, I'm not doing that.
Yeah.
And ever since,
how to recommit yourself.
That's correct. And ever since, that was my first semester there. And after that, it was smooth sailing again.
Yeah.
So just that one statement, I remember that vividly. I was in the hallway, kind of crying on the phone. And this is when phones just came out. Yeah. So we didn't have the iPhones. We still had that Nokia kind of the flip phone. Yeah. Yes. So you could hear them, and you can call them only after 7 p.m. because you didn't have enough minutes, right? Yeah. But I vividly remember that statement. And ever since then, my whole thought process of my life changed. Mm-hmm. So easy question of who it is, but very strong positive influence changed kind of who I am.
Yeah. Huh. I know. I need to think about this a little bit more, because I've had many people that have had an impact on me. I'm just trying to think, who had the most impact. I'm going to actually say it's my therapist. And this therapist, I was seeing her on a weekly basis, and this is post-COVID or around COVID time. So it was FaceTime. And, but I think what it was that we really connected because I was allowed to be me, and it was very, very raw. And she always gave me permission to be as authentic as possible. I'm not saying that, previous therapists didn't allow me to be authentic, but I think that by being on FaceTime, I was in my home. It was on my day off, and it was at 8 a.m. in the morning. So no makeup on, jammies, you know what I'm saying? And then I still had my cup of coffee, and I was able to just talk and cry as much as I wanted. And I would have my roll of toilet paper there. But what she always said to me was that, I believe in you. I believe in you. Like every time when I had some form of self-doubt, she would just always keep saying, Katie, you're doing hard things. You're doing hard things. And look at you. Look at you. I really do believe in you. And it's funny, but not funny. I've been using that phrase in my practice. Every time, because we're in an immigrant community. And so sometimes our patients, they might be like struggling in terms of reading the acuity, the letters on an eye chart. And so you're not sure, is it because of a language barrier? Or it could be that this is their first eye exam ever, right? Coming from another country. And so as you're seeing the patient struggle, and then all of a sudden, either my staff or I will say something like, oh, just try. I believe in you. And all of a sudden, I don't know if it's a miracle or not, but they read all the way down to the smallest row just by telling them that I believe in you. And so, I think just having those words being said to me as I was going to therapy and my therapist, she ended up getting diagnosed with cancer. And by the time she found out that she had cancer, it was already, it was metastatic. It was stage 4. And so she had about a year, and then it went to her brain. So she was my mentor, so yeah. So I think.
Try other word here.
Yes.
Say, if your closest friends threw you a surprise party, what would the theme be? I'll let you go first on this one.
If they threw me a surprise party, what would the theme be?
You just had a party yourself, so.
Well, I know. Well,
was it a theme?
So wait, no, there wasn't a theme. It was, maybe it was just Katie's style. So what Elson's referring to is that I this month, October, is a huge, huge month for me. This month is when I opened up my practice 30 years ago.
Congratulations.
Yeah, thank you. Yes. So 3 decades of practicing. That's a huge milestone. But this month was also the month that I was diagnosed with breast cancer back in 2012. And it happens to be also tied in with Breast Cancer Awareness Month. So everything is very, very, special for me for October. And so the party that I threw had colleagues, friends, financial advisors, just everyone that's been, supporting my practice. They were all there yesterday. So it was nice, but I don't know if we had a theme. It was it was a theme of gratitude. But for me personally, I would love to have like a Great Gatsby kind of murder mystery type of theme party.
Oh, yeah.
Yeah, I think there's some mystery to it, and yet we get to like play act and dress up. I think that's what I would like to have. Yeah.
I see people do that all.
Yeah, but I've never had one, so I would love to have one.
Yeah. I was invited. I just unfortunately couldn't make it this weekend. So she did invite me to the party.
Yeah.
I found out, she
Yeah, it's just like a wedding invitation. My party was like another wedding for me. And so I just want to let you know, you were on my first tier guest list.
Oh, thank you so much. Thank you. So thank you so much. So this is, I every time I want to throw a party, and this is always the theme that I want. I don't think I've ever not thought about this theme, and I love just a black tie event. I love tuxedos,
Yeah.
and I just think everybody in a bow tie.
Yeah.
It's just something about that, and I love that,
Yeah.
and that's my theme.
Yeah.
The 007 theme, kind of.
Yeah. You know what? I'm going to call it what I feel. It's magical.
It is.
It
It's
is
just something
magical.
special. When I grew up, I saw people in limousines coming out with tuxedos. I'm like, wow, they must be so rich. Like, that's what I want to grow up and try to emulate there.
Yeah.
And so I've always had this dream of like tuxedos, even if it's like a party that's just a business casual with that's what I do. It's a bow tie
You'll show up in a
and tuxedo, but I won't wear a tie. Bow tie. I'll just wear a black tie. So it looks like it's, like
tuxedo
in a
suit.
tuxedo suit. That's correct.
I love it. Okay, so I have to play off of that because so for my celebration yesterday, a lot of my guests had texted me like, "Hey, what's the dress code?" Right? And then one of the guests actually flew out from Florida just for the event. And I'll give him a shout out. It was Nick Pisani from TopCon, but he flew out from Florida. So thank you. But the thing is that he asked me, he goes, "Hey, normally in Florida, if I get invited to like a yacht or whatever, and I'm in shorts." And he was, "So is that okay?" And I said, "You know what? If I told everyone else business casual, but if you can rock those shorts, then go for it, right?" And I said, but I did say this. I go, "But for me, I'm going to be in a gown. I'm going to be in a ball gown." And that's how I roll. That's what I put. I go, that's how I roll, is that I love gowns, right? And then so if everyone else is wearing casual and I walk in with gown, it doesn't bother me that I'm different. It feels good for me.
That's right.
So it's kind of like your suit, your tuxedo suit.
So did he rock those shorts?
No, he didn't. He went with the business.
That's okay. I actually know Nick. I know Nick. Yes. He was with Psych Science before he got to so I know Nick. So hi, Nick.
See, look, you got 2 shout outs. Look at this. So what? I think you answered.
Yeah, he says, "Sir, yeah."
Okay.
Time for a hard one here.
No, I think that first question you asked was in the wrong bag. That was a hard.
Yeah, that was. I thought, yeah.
All right. What's something you had to unlearn in order to grow into who you are today?
Wow, that one is hard.
Actually, I think I know this one.
And you go first. I'm gonna read the question.
Yes, hand it to you.
Sometimes reading it makes you
Yeah.
Yes.
So you can read it again. Let me just think a little bit more about what I have to unlearn. Okay. All right, I'm going to go for it.
Okay.
So earlier you touched upon Asian parents, right? It's very common, part of our culture, but I think it's getting better right now. But part of the older generation, there is no PDA. You don't see your parents holding hands or showing any signs of affection, nor do they even show it to the children. Like, they don't say, "I love you." And I remember, just growing up and seeing non-Asian parents showering their kids with hugs and "I love you" and all that. But I think that's part of how I also developed this imposter syndrome. I know it's such a cliche because everyone's using imposter syndrome, but that's what you call it nowadays, right? And I think that came from my parents being very overprotective and always telling me that you shouldn't be doing that. You're a girl. Girls don't do that. And so being a single parent and raising 2 daughters, I knew very clearly from the beginning that I was going to do the opposite of what my parents had taught me. Even though it was a little bit too late for me, I made sure that it wasn't going to happen to my daughters. So I've always supported with every decision that they made, even if I was a little bit fearful or anxious inside. I allowed them to dare themselves to do the impossible. So with that being said, I turned 57 this year, okay? And I've been telling my family and friends and my patients that I kind of feel like I'm reborn. That not that I'm going into the last phase of my life, but that I'm actually starting a first phase of this new life. And this new life is that I am being so much bolder because I'm telling myself that I need to unlearn what my parents had instilled in me, that that I can do the stuff because I'm a girl, right? I don't even want to use the word despite I'm a girl. I can do hard things because I am a girl. And that's what's beautiful. So that's what I've learned.
That's a great story. I'm still thinking about like
That's okay.
like
That's okay. That's why you need to gnaw on it.
I don't know if this directly answers the question, but I want to let people know that, you know, when you do grow up in this kind of society where your parents, you know, are immigrants, they come in and they expect you to be a doctor, lawyer, you know, accountant, something that is a kind of a for sure career that they know that you're not going to struggle, you have a job and all that. And sometimes, you know, you have to do, I let people know now, you have to do what makes you happy.
100%.
You know, and coming to work or going to work, you got to be happy. Otherwise, you're just going to a job and you're never going to be happy. So I had to unlearn how to not take everything so seriously. And where my parents were like, you got to do this, this, and this.
Yeah.
Where I just said, you know what, I'm going to do it the way I want to do it. And that's how it's going to be. And I kind of, for the last 12 years of my life, that's kind of how I live life. You know, my father passed when I was younger. I was going to residency, and, you know, I saw him work so hard that he didn't really get to enjoy the fruits of his labor, right? And so my whole thought process changed at that time too, where I kind of unlearned everything that he did, right? Work hard, save. Work hard, save. Now I work hard, but I don't save as much because I wanted to do it my way. And so I don't spend extravagantly. I make sure I live within my means still, but that's what I've unlearned. I saw that and I unlearned that to do what I wanted to do. And that makes me happy.
Yeah.
You know?
Yeah. You know, as you're talking, I'm like, you know what? I'm nodding this entire time because I think I kind of did the same thing. You know, I've learned to not do the traditional way of working hard and just saving and not living life. And I think for me, this whole journey or process of living life for me, these last 2.5 years, it's just been, everyone's been saying, hey, Katie, you're on fire right now. And I know what it's coming from. It's working, but doing what you love to do. And I found out that I do love seeing my patients. Once that, you know, switch clicked in my head that I love seeing my patients, it's no longer work anymore, right? When I come in, it's very, very fulfilling. And then in terms of the savings, I save, I do save, but I'm not going to save to where I'm not enjoying life. But what I've learned is that for me, I love to spend the money on others. I love it to spend it on others. And that's what I do. I do that.
I'm going to echo that. You know, my biggest satisfaction is really going out with friends and having a nice dinner, and I just take care of the bill. And that's how I give. And that gives me the most satisfaction.
Yeah.
You know, and it's just, I know they can take care of it, they can do it, but for me, it's just like being able to enjoy a dinner with them, a nice dinner with them, and then I'm able to take care of the bill and nobody has to worry about anything. That's what gives me the biggest joy, to be honest. So.
I know we're still on this one question, but I want to continue on that a little bit. The reason is because, oh my gosh. So you mentioned about my celebration yesterday. Well, it ended up being a quite a bit of a extravagant celebration because it was tied into my 30th year anniversary. But even if I didn't have the 30th year anniversary, it would have been my 4th year of giving back to our industry. So every year since COVID, around October, November, December, around the holidays, I do a gratitude luncheon with all of my vendors. And so I'm putting it out there in this space, okay? My vendors, my sales reps, they all go, Dr. Chu, you're the only one that has ever done this for us. And I keep hearing that. And these are sales reps that have been in our industry for 30 plus years. And I'm going to put out that challenge. Everyone should do a gratitude luncheon and show how much you appreciate for those who support your businesses, right? 100%. So that's my way of giving back is that, I treat them to a very nice luncheon in honor of them. Yeah, amazing. Yeah, it is amazing. I mean, it's an amazing feeling to know that they can hear me and I'm showing up, if that makes sense, to display my gratitude. It's really, that's what it is that
Two-way street, not a one-way street. It's a two-way street.
Yep. I always practice gratitude. So, all right. Was that an easy question or a hard question?
That was a hard question.
Okay, so it's your turn.
Yeah. These are not as easy as they sound here.
Wonder what did my staff do? Does she like print out hard questions for both sacks?
What's one little thing that makes you feel instantly confident when you walk into a room?
That's easy.
That's easy. I know. That's what I was going to say. What's one little thing? I mean,
really read it again.
What's one little thing that makes you feel instantly confident when you walk into a room?
All right.
I don't have anything in my teeth. That makes me confident. Yeah, as long as I don't have anything in my teeth, I know I'm confident.
Yeah, let's see. Or like bird poop in your hair. Absolutely. Instantly confident when you walk into a room.
I think this is something different for everybody.
No, I know. You know what? I think for me, because I read people, right? That's part of who we are as doctors, right? We've learned to read our patients. So I've been good at reading rooms. So I think I would have to bounce off the vibes of the room. Like, so if they're laughing and joking, then I'm going to walk in probably a lot more confident. But if everyone's very stoic and serious, I would feel more anxious. I think because I'm not sure if I would fit in. Yeah.
But I think picking off about that is in high school I wasn't the very most confident person. There's I wasn't the prom king or best looking or there's like people that got got into all the clubs and everything. But there was something that changed where I felt like some self-worth, like I had direction, and that was like going to med school for me. So that instantly gave me a little bit more confident because I was like, okay, I could do this, because everybody else, when it comes to family, like friends, right? Asian parents love to compare their kids. That's a fact.
Yeah.
Maybe not as much now, but during our generation, they did that. And so when I got there, it was almost like a chip on my shoulder saying, hey, you guys told me I can do it. And that kind of gave me the confidence. And it kind of trickles down to now where, I wear scrubs every day.
Yeah.
And I probably wear the brightest scrubs to work. I wear pink scrubs. I have bright orange ones, yellow ones. I'm wearing a purple one right now. I don't wear the traditional blue, black, but that's like that. I walk in confidently with those colors, my favorite colors of the scrubs are pink, and I'll walk in with pink and I'm rocking it confidently, and nobody's gonna say anything, and I feel confident when I walk into the clinic, and people know that I'm here to work and let's get down to business.
You know, it's funny because it's like I answered the question, and then when you're talking, it's like it's starting to pull more things out of me. And it's funny because you were talking about scrubs, right? And I don't wear scrubs at my practice. My staff does, but I don't. And it's a choice, right? And but you know, when that moment changed for me was again, it was during COVID. And you know, COVID just really did a reset for me. And so when we were kind of, I know we were, what do you call it? Having to like show up for patients, but as an optometrist at that time, you know, it was only for like red eyes, things like that. So a lot of times I was still at home, right? During that 3 months of lockdown, I guess. And in order for me to delineate my weekdays from the weekends, because everything would start blending, I would dress up.
Well,
Monday through Friday, I purposely dressed up. And then Saturday, Sunday, I dressed casual.
okay.
It was just to help me mentally, right? And then once we started going back to clinic again, I thought to myself, it's like, I felt good dressing up. And then I thought, you know what? Life is way too short, right? And in my closet, there's so many things that if tomorrow's my last day, I would have never touched that, right? To wear. So now in my closet, nothing is off limits. So I will wear a Chinese traditional cheongsam to work. I will wear sometimes a gown.
See, that's confident right there. That's
I know, but I didn't realize that when you first read that question, like walking into a room, I wasn't thinking, but I walk into my practice dressed up. And so, yeah, and some of my 90-year-old patients, they'll see me, they're like, oh my gosh, Dr. Chu, you look like you're going to dress up for a party or a dance party. I go, yeah, I'm going to dance with you after the exam.
Yeah. Like I was so casual in clinic, you know, I just wear scrubs because when I first started my practice, I mean, when you look young, patients don't really trust you, you know? And so I started wearing scrubs so people knew, hey, you're the doc. And at that time, I didn't really have that many, you know, employees. You know, now, you know, everybody color matches, you know, so we know who the employees are, and then the docs wear a certain color so they know who it is. But it is funny. Now I wear scrubs because I'm just too lazy to do laundry, you know, and my closet is literally t-shirts, but it's t-shirt from the same brand, but it's in different colors. And so I'm very different from you. I'm like, I can't do laundry. I'm going to throw everything into the laundry and I'm done. Like, so.
But remember, this just started, you know, in
Like,
20. Yeah.
That is amazing. I mean, I just think about like, if I have to wear that clothes, then I got to take it to the dry cleaner and then I have to do this. Like, for me, it's like, I'm just so lazy now. I just wear scrubs and then like constantly.
I have patients that ask me like, oh my gosh, Dr. Chu, you look so pretty. And I go, yeah, I dressed up just for you. That's my line. So, all right. That was an easy question. Wow. All right. So I think we'll do one more round and then let's see, what's this one? What has life taught you recently that you didn't see coming?
What has life taught me recently that I did not see coming?
Let's see here. Trying to think.
Man, this was a hard one.
This is a hard one. It is a hard one.
What has life taught me recently? I don't think life's taught me anything recently.
Well, sometimes life can kind of sneak in with those little messages, but then we miss it, you know, because we're so busy with things. Okay. I think I know what it is. For me, at least. So, you know, I don't even know this. Do you have any children?
I have a little 1-year-old now. So.
Oh, boy or girl?
Boy.
Boy,
Yeah.
okay.
So, I mean, that's taught me a lot. But yeah, I don't know if...
Yeah. Well, the only reason why is because I have 2 daughters. And I don't know if I'm really answering that question because maybe it's the way it's phrased. But, you know, if I'm going to extrapolate or whatever, my daughters are part of my life, right? So what has life taught me that I didn't see coming? I have realized now that, you know, being a parent and raising a 1-year-old and all that and going through all the motions of being the best role model to your to your kids, that's a responsibility, right, as a parent. But now that my older one is 27 and my younger one's 25, I have learned now, which I didn't see it coming, is that they're teaching me. I'm learning so much from them. And I see it so clearly of all the things that they are teaching me to unlearn from what my parents taught me. And because I'm seeing how they embrace life with such boldness that I'm learning from them.
Awesome.
Yeah. Did I answer that question?
Yeah, you did.
I did, right?
Yeah.
I'm like, I feel like I did, but I kind of went around it.
I mean, now that you mentioned it, I'll tell you this. When you go through schooling and life, and you kind of have blinders on, because I have missed so many things of friends, parties and weddings and family trips, because you go through schooling until you're 31 and you miss a lot of things. And when you start practice, same thing. All you do is concentrate on your practice. But I have to say, nobody has ever taught me this until you go through it, is having a child, you'd never thought you could have that much love for something that doesn't do anything, right? They get tired, they don't sleep, they poop, you gotta change their diapers. But, my brother has 3, and I love my nieces and nephews to death. But I thought that was the extent of it when I had my own. But in reality, it's like a whole different love.
Yeah.
Right?
Unconditional.
Unconditional. It's like almost like an obsession, at least for me, and it has taught me that, if I have a really angry patient, I don't care anymore.
Yeah.
Like, I'm going to be going home to family and my little boy. And that's taught me a lot. Before, I was always like, I get a little 1-star, review, and I would like just eat me up. Like, what did I do? Like, I didn't think it was that. And, and of course we try to, make our patients happy and all that. But
100%. We're always trying.
Yeah.
Yeah.
And sometimes people we don't see eye to eye up, and they're upset about it. But, I'm doing this for 12 years now. Like, I don't let it eat me up anymore, because there's more important things.
And you shouldn't, because I just want to say this, you need to know your worth.
Yes.
And I'm going to say this, I see you. I do see you. You don't understand. When I talk about you and how you serve our community, what you do for our Medicaid patients, it's just, that's what pulled you, me to you, is your devotion and commitment to our community, right? And so that's what I'm saying, is that it's on them. If they're going to be giving a 1-star or whatever it is, it's only them. If that makes sense, that's how they saw the experience, or whatever you want to call it. But you just have to know who you are. And so, I just want to say, like, you have so many people that think the world of you. And so, and I've had to learn the same way, is to let things go. Like, some of these things, it's really like, it's like part of my podcast, right? We need to chew on the things that really matters, right? And our children, 100% is what matters, right? And there's a lot.
Yeah.
So, did you answered it, or I answered it?
We both answered it.
We both answered it. I think we're good, right?
Yeah.
Unfortunately, I didn't even check the time. When the hell have we been talking?
I don't know.
We will do one finale then, okay? And then I'll pulled it from who or what reminds you to slow down and be present when life moves too fast.
I think my answer is the same answer I gave last time.
Yeah.
I don't know.
So your son.
My son. 100%.
To be present when life moves too fast. For me, I'm going to have to pull in my faith.
Mm-hmm.
It's going to have to be God.
Mm-hmm.
God is the one that reminds me to slow down, and that he's the one really that is in control of the timing of things.
Mm-hmm.
I'm not in control of it, so I need to let that go. And yeah, and if I feel I'm so much more freer now, just knowing that I can live each day without fear.
Mm-hmm.
And I think yeah, so when the world's spinning so fast, I talk to him. I talk to him every morning before I come to the practice. And so, yeah, I think he's my reminder. So.
Life moves fast.
Huh?
Especially when you get older. Life moves fast. I mean, year after year. I can't believe it's almost, I mean, Thanksgiving is going to show up next week. It's crazy.
Yeah, well, my daughter and I went to Fashion Island last weekend, and they had Christmas trees up and in the department stores. Mm-hmm. But then we also saw Halloween decorations 50% off. Usually that's done after the holiday, where it's not even, I mean, I'm just saying, oh, wait, we did pass Halloween. That's how fast.
Mm-hmm. No, we're in Halloween yet.
Wait, we're not in
Halloween.
Oh, my
10 more days. 10 more days.
10 more days. Yes. Oh, my goodness. So, well, I want to thank you so much for your time, for being here today. Yeah. And so, to all my audience, I just want to say, live your best life, live your most authentic life by seeing things clearly, leading boldly, and also living purposefully. So until next time, take care. Thank you. Thank you so much.
Thank you so much.